Can you prevent your newborn child from developing a peanut allergy? The short answer is yes, you can. I'm going to talk about that here in just a minute. I'm Dr. Peter Montgomery, a family practice doctor with 30 years of experience, and I'm here to share you with what I know. Every month, I get the American Family Practice Journal, and we're supposed to keep up on our continuing medical education. So I decided I'm going to read with you every week like I have to keep up on my reading about this. And they have a topic on here on food allergies, diagnosis, treatment, and prevention. I'm going to go over that in just a moment, but first I'm going to talk about my sponsor, which is a free clinic near you. And here I am advertising for free the National Association of Free and Charitable Clinics. They have a great way to get you in touch with a free clinic near you. There are literally over 1,000 of them in the country. And you can, of course, donate to this group to help them do what they're doing. You can find a clinic near you. I'll type in St. Louis, hit the find button within 10 miles of downtown St. Louis, and there's a whole number of them. One thing I noticed right away is there are 6 of them with the same name here, and it is the IFM Community Medicine Clinic. They have multiple locations around the city. They are run by Dr. Campbell. He started at this back around 2000, and he has been keeping it going and is spreading and keeps opening more and more clinics. This man is a machine. I work with just one clinic, the Crossroads Clinic in Lake St. Louis, but he has started 6. He is doing fantastic. He works with the Crisis Nursery here in St. Louis and does lots of wonderful charitable group work. And so if you live in St. Louis, look them up, see if they can help you. If they can't help you, there are other free clinics available in the St. Louis area. So use the website to help find them. I work again with the Crossroads Clinic in Lake St. Louis. So I got a shout out to my own clinic out here. Here's our phone number, how to make an appointment and contact us. You might not need free medical care. You might have insurance, but you might have a family or a friend or a neighbor who does not. And so we are here. If you want to help volunteer, please, all these sites have a volunteer button. They all have a donate button. Find somebody who you feel enthused about, that you really want to help support them, and please help us help others. Thank you very much. Now, getting back to allergies and how to deal with allergies. So here's the article about food allergies, diagnosis, treatment, and most importantly, prevention. Every article, this is the first time showing you some of this, every article starts off with a very good summary that covers all the major details. And the main thing is that 2 to 3% of adults and 8% of children have a food allergy. That's because most of the kids eventually outgrow it, but some people, they are lifelong food allergies. They can be mild itching and hives and even life-threatening anaphylaxis. And this causes a lot of problems. The most common food allergies, the most common one is peanuts, also one of the most severe ones. Cow's milk allergy is second most common, then shellfish, other nuts, eggs, fish, soy, and wheat. Now getting on to the main topic is what can we do to prevent them? And early prevention strategies involve avoiding cow's milk in the first 3 days of life. That is very important to avoiding the cow's milk allergy. And then early and sequential exposure to allergic foods starting between age 4 and 6 months. I know it sounds backwards. I don't want my kid to get a food allergy. I'll just avoid the thing. That is actually how you cause most food allergies, is avoiding exposure during a very important part of our development when we're learning what is food and what is not food. And so if you start feeding kids food at about this age in tiny amounts and slowly increase it, they are less likely to develop a food allergy. Exclusive breastfeeding. Also, for the first 3 to 4 months before giving them food, definitely decreases the development of eczema, asthma, but by itself does not decrease the development of food allergies. You need to do the sequential exposure to allergic foods. Most kids will outgrow it, but sadly, the tree nuts, peanuts, shellfish, and others can be lifelong allergies. Another great feature of the American Family Practice Journal organizational style is to quickly put up what they call the key recommendations, and they actually have a grading system for them. If it's an A, it is based on consistent, good quality, patient-oriented evidence. So we really like that A quality evidence rating. Not everything has that good a rating. B is inconsistent. There's at least one good study, but there's not multiple good studies. C is consensus. A bunch of experts get together, they have an opinion, but there's no actual study saying this is definitively the best. So the A evidence is for the early introduction of the peanuts and avoiding cow's milk. And that's very consistent from randomized controlled trials and observational studies. So the best evidence is for the introduction at between 4 and 6 months of age for people at risk for developing food allergies. The second best evidence, the B evidence, is for early introduction of peanuts and cooked eggs at 4 to 6 months, and it is safe and effective for reducing food allergies for these high-risk infants. The serum immunoglobulin E or skin prick testing should be performed only when a detailed, focused history shows that there's a risk for food allergy. That's just, good common sense, and that especially before testing people, we should find out what they might be allergic to just by talking to them. So basically, this is common sense. Talk to the patient first, then test. Next, they often have a section of best practices. Again, do not perform screening tests for food allergies without actually taking a history first. Do not perform skin prick testing without taking a history first. And do not avoid influenza vaccine routinely in patients who are allergic to eggs. In most situations, it's actually safe to give it if it's just hives, and they go over that in more detail down below. What are your risk factors that your child will develop allergies? Someone who has a latex allergy is much more likely to develop other food allergies. If they have asthma, urticaria, which is high, so they get really bad reactions to bee stings. Who does not have a really bad reaction? They have runny nose, you get eczema, or atopic dermatitis is the fancy word for it, or allergies to other medications. Symptoms, pretty straightforward. I kind of broke them down to minor and major. Of course, the major ones are anaphylaxis. Down here, that's obviously the scariest one. Rapid heart rate, shock, intestinal problems. Mucus and blood in your stool that is considered minor. Of course, worse would be swelling shut of the esophagus. Respiratory, cough, congestion, runny nose. Of course, against tight chest, shortness of breath, and wheezing being severe. Hives being bad, but actually angioedema, fancy word for the really blown out lips and eyelids, another tissue that can really swell shut. And of course, the back of your throat is made of that same type of tissue, and that's what causes the anaphylaxis and the difficulty breathing. Then they have a list. It's called the differential diagnosis. In other words, other things that look like food allergies but are not food allergies. Allergic reaction to another substance that you had around the same time you took the food. If you get eat some food and then get bit by a bunch of mosquitoes, you go, oh, what's this rash? It's the food. Well, it could be the mosquitoes. Lots of other things that people just avoiding food. Or Munchausen syndrome, our fancy word for the patient's lying, or the parent is lying, which is by proxy. The parent is, sadly, it's a real thing and actually happens. Chemical irritant. Someone rolls around the poison ivy, then eats some food, and later they break out with the hives from the poison ivy, but they think it's the food. Just food intolerance. If you're lactose intolerant, you drink milk and you get belching and diarrhea, that's not an allergy. You're not breaking down the sugar. The gut and your bacteria is, and they do it better than you. You could just have a virus at the same time. It could be another disease called inflammatory bowel disease, a very serious disease that needs to be checked out. Irritable bowel disease, very similar presentation, and needs detailed testing to find out the difference. Or the vasomotor reaction from hot and spicy foods. That's not an allergy. That's your body reacting in a otherwise safe way. And a lot of spicy foods are actually hot. There's a thing called Scoville units, a way of measuring how hot the food gets. You break out a sweat because you are actually hot. A lot more detail on what we can do as far as treatment. One thing is elimination diet. Eliminate all suspected foods, and usually the most common ones, and they're labeled on there by law, so you can help avoid them. You break it down to a very simple diet. If your symptoms go away, it's probably it. Then getting allergy immunotherapy, going to the allergist, taking, of course, the detailed history of potential allergens, family history of allergens, and then actually doing the skin prick testing to find out what you're allergic to. And there are medications to help prevent the serious, dangerous anaphylaxis. First-line therapy, patients can be given a prescription for EpiPens. They give epinephrine in an injection. Some people, you can get it in a vial, you drop it in your own syringe and inject it. The very important thing to mention is it's not one shot and done. You may have to repeat it in 5 to 15 minutes. I always tell my patient, this EpiPen is a bridge to the emergency room. And they always come in packets of 2. You give one, you get in the car, or you call the ambulance, and someone sits there at the ready by the patient, ready to give the second shot. And then, if you have these other medicines available, great. Otherwise, in the ambulance or in the hospital, they will be giving you albuterol inhalers to help you breathe, and antihistamines to calm down the allergic reaction, oxygen if you're having a hard time breathing, IV fluids to keep your blood pressure up and keep you from going into shock, and laying you on your side in what we call the recumbent position. That's laying on your left side, preferably with your feet up. So all these things help you survive. The hospital does the same thing. And then they'll send you home with an EpiPen, 2 doses, as I said, every single time. Education on what to avoid. Follow up with your primary care physician, because a lot of times people things aren't communicated well at the hospital in the emergency room. People are sometimes in shock or denial, and the doctor will review your case with you and go, no, this was really important. Or a patient says, I didn't start my medicine because I'm worried about it. And your doctor will talk with you, give you reassurance, and explain what was not clearly explained in the hospital setting. And, of course, make sure you get to the allergist for the testing and the more detailed treatments and the ever-important desensitization treatments. And often they will give you antihistamines for several days afterwards, and steroids. Steroids prevent mainly prednisone, dexamethasone, several other steroids are given to prevent what's called a delayed reaction. There's a weird reaction to some allergens that don't start until about 4 to 6 hours after exposure. So again, the big topic was about prevention and what can be done about that. And the best thing to do is to do the desensitization process, and there's even a company that helps with that. So not to show any favoritism, there's a couple different companies that provide peanut powder to give to your infant at the right time. There's Little Mixins. There's another company called Ready Set Food, and you mix in the peanut egg milk powder in with their feeds, and they have you go through it. They're following the directions from the Allergy Society, and these are ways you can do it in a safe manner so you know you're getting a product that's been tested. If you start off early with an infant, you can prevent future food allergens. If you're already allergic, you need to get properly tested, get a good history, find out what you're allergic to. They can slowly desensitize you to the things you're allergic to. There are kids who have had deadly allergies to peanuts who over time can now accidentally eat a peanut and not wind up in a bad situation. They still are not recommending, once you've had these testing, go, eat a peanut bag of peanuts. But if they accidentally ingest it, you no longer have that fear, and that's a great relief to a lot of kids and their parents. So yes, food allergies are preventative if we start off early and you can still get good treatment if you are food allergic, and also find if it actually is an allergy or if it's something else that mimics an allergy. Good to find that out. When, of course, we can help you at a free and charitable clinic near you. So go to the National Association of Free and Charitable Clinics and go to their website and see if they find a clinic that can help you and help you out with your issues. So I'm going to be making more videos because I got to keep up my own education, and I'll help you keep up with yours. So once again, Dr. Pete, MD, nice to have you hang out with me again, and I'll see you soon.